Oncology physical therapy is not as well known by the general public or even doctors, but according to the National Institute of Health, 1 in 3 Americans will get cancer in their lifetime. And in the UK, it's 1 in every 2 people. With improved and innovative treatment as well as screenings to catch the cancer earlier, the number of those living with and beyond cancer is in the millions and growing each year. So with all of these millions, who's addressing all of the side effects and symptoms that come with and after the treatment is done? Well, oncology physical therapists and physiatrists do just that. My name is Kelly and I am a physical therapist and I am a board-certified oncology clinical specialist. In this video, I'm going to explain when to go see an oncology physical therapist, what side effects or symptoms you may see, and what types of things we do to address them so that you can get back to focusing on what's most important in life. And for other topics on oncology and lymphedema therapy, be sure to subscribe down below to follow along for weekly new videos. So the first thing is fatigue. Fatigue is expected about 90% of the time with chemotherapy and or radiation. And for about 65% of those individuals, it will go away on its own about 3 to 6 months after treatment is done. But for the other 35%, it may linger for months to even years. Fatigue is one of the most common side effects of cancer and its treatment, and it is something that your oncology physical therapist can help you treat. We work with each person to help address their individual needs. However, it's been shown over and over and over again in research that exercise during and after cancer treatment can be more beneficial to help decrease fatigue than something like medications. Your oncology physical therapist can help assess where to start and what may be the best option for you for a home program that is safe, effective, but also something that you really enjoy. Ideally, we're always looking to add some sort of cardiovascular component most days of the week, as well as weight training or resistance training. We'll also look at stretching or range of motion, and again, add anything that you specifically want to get back into. I have created a video on cancer-related fatigue and various types of interventions that physical therapists will use, and I'll place a link for that up above or down below. The next thing to see an oncology PT for is neuropathy. Chemotherapy-induced peripheral neuropathy can occur in the hands and the fingers as well as the feet and the toes. Some individuals will have tingling and numbness. For some, they may have sensitivity to cold or touch, and for some, it may just be pain. Along with the sensory issues or more intense issues may involve the motor function, which can decrease your balance and lose muscle mass or muscle strength, as well as decrease muscle activation. So for example, if you have the motor dysfunction from neuropathy in your feet and your ankles, it can cause weakness so that when you walk, you're not able to pick up your toes or your ankle as well, which can cause what we call foot drop, which can then lead to tripping over yourself or imbalance. You may also notice if you have motor loss in your hands from neuropathy that it's difficult to hold a coffee mug or open a jar. Neuropathy can be really frustrating. It's typically one of the slowest things to recover after treatment. In therapy, we will work with each individual to address things such as exercise, vibration, desensitization, or other balance training. I do go more in depth on this topic and these types of interventions in another video, and I'll place that up above or down below as well for you to check out. The next thing that oncology physical therapists may address is weakness. Lean muscle mass or strength loss is a common side effect of cancer itself or even its treatment like chemotherapy. One may also have weakness after a surgery due to the inactivity. You may hear a term like atrophy, which is muscle loss, or in severe cases and extreme loss, we may call that 𝐭𝐿. It is crucial for an individual to at least maintain muscle mass during treatment, but hopefully improve and build strength even after treatment is done to help improve function and even quality of life. The research shows that by addressing the strength loss with a physical therapist who can create you a home exercise program that is safe for you to do, that you can significantly improve your muscle strength and function, even with resistance training or weight training 2 to 3 times a week. Typically in therapy, we address large muscle groups to begin, some for the upper body, lower body, and core, but each program is tailored to each person for safety and effectiveness. The next is pain. Pain is really common after surgery or even due to the cancer itself. One may also have pain after something like radiation due to the tightness and the swelling that can occur. Your oncology physical therapist may be able to assess and figure out why you may be having pain and how to decrease it, or we will help you follow up with your oncologist or your doctor to help figure out why that pain is occurring and how to safely minimize it. The next side effect that oncology physical therapists can help you with is imbalance. Balance is a common side effect, like we talked about before, of something like neuropathy, but can also be caused due to more weakness. Changes in proprioception, which is knowing where your body is in space, can really make activities around your house difficult and even unsafe. It has been shown that if you have imbalance due to the neuropathy symptoms you may have, that if we address the balance itself and train the balance, that we can improve it, even if you still have the neuropathy symptoms such as the tingling and the numbness. So your therapist knows how to do appropriate balance training safely and how to progress that to help improve your balance overall. This can make someone feel more steady on their feet or more safe in their homes to help decrease risk for falls, which can lead to something like a fracture. Next is lymphedema. Lymphedema related to oncology or cancer is what we call secondary lymphedema. While primary lymphedema is caused by some sort of genetic condition, secondary lymphedema is when it's caused by a surgery or another procedure. So in this case, it's typically seen with lymph node removal as well as possibly radiation. So for example, if you had lymph nodes removed from an armpit area, then your therapist is going to help watch that arm and that chest wall to see if you have any signs of swelling or the lymphedema. Your oncology therapist may also be a certified lymphedema therapist like myself, but if they're not, they will likely refer you out to a certified lymphedema therapist who can help screen and check for any lymphedema. And if you do, they will help decrease the volume or size, help decrease your pain, improve your skin health, and reduce your risk of getting any infections. I have a large number of videos on my channel about lymphedema treatment, and I'll pick a couple of those and put some links down below. So let's talk about 𝐭𝐴𝐴. 𝐭𝐴𝐴 is a short, easy way of saying axillary web syndrome. It's most common after breast cancer surgery or melanoma surgery. Although the medical field is not 100% certain what 𝐭𝐴𝐴 is, it is strongly felt that it is caused by damage to the lymphatic vessel during surgery. Many cords show up right away, although some can be delayed and show up months later, and a lot of them will go away on their own. However, your oncology physical therapist can help speed up this process, because although they're not going to cause a lot of harm, they can be really painful and restrict your range of motion. Your therapist or physio may work with interventions such as stretching, nerve glides or nerve flossing, or even some myofascial techniques. I will link my axillary web syndrome video up above or down below for more information as well. Lastly, we're going to talk about loss of range of motion or tightness. One of the most common side effects that we see after surgery or radiation specifically is that loss of range of motion and that tightness in whatever area was affected. It's common to see tightness in the chest wall after breast cancer surgery and radiation, same with head and neck cancer, loss of range of motion in the neck, as well as pelvic radiation. We may see it internal or external around the pelvis. This tightness and loss of motion can be caused by scar tissue due to the surgery itself, but it can also be caused by what we call radiation fibrosis syndrome. To summarize, scar tissue and fibrosis can both build up in the area that it was affected. When it builds up, this can cause a lot of tightness and thickening of muscle fibers, muscle tendons, or even ligaments. So when we think about the specific muscle fibers and tendons that are affected and thickened due to the fibrosis and scar tissue, they are not going to be as flexible or pliable, which can then lead to the tightness and restriction. Your physical therapist or physio can show you the best type of stretches and exercises to address this tightness. You want to make sure you work with them to show you the safest way to do it and the most effective for you. They may also try some sort of myofascial release or other manual therapy techniques to help soften the scar tissue, soften the fibrosis, so that the health of your tissue can improve and you can get your full motion back again. For other therapists or people who want to see my favorite stretches that I like to use after breast or melanoma treatment specifically, I'll place a link for that up above and down below as well. So those are the main side effects or symptoms that your oncology physical therapist can help address for you before, during, and after cancer treatment. Although those are the main side effects and symptoms someone may see, they are not all of them. So if you have any of those or any others, that would be a great time to reach out to an oncology physical therapist or physio in your area to help get the support you may need. Please remember, although these are very common side effects and symptoms, we do not consider those normal, and they are something that can be addressed. And by addressing all of these side effects and issues, then you can get back to focusing on what's most important in life to you. If you found this video helpful, please press the like button down below, and I'll see you all next week for another video. Thanks, everyone.